You just finished. You are lying there staring at the ceiling wondering if you just boosted your health or destroyed something important. Every single man has had this moment. Every single man has wondered. And almost nobody actually knows the answer. I am Dr. Brandy, a board-certified urologist who has spent over a decade examining more private parts than an airport security scanner. And today, I am giving you the complete truth about what happens when you ejaculate every single day. No myths, no guilt trips, no bro science. Just actual medical facts that might completely change how you think about your body. One quick thing before we get into it. I created a free men's lifestyle guide specifically designed to help prevent prostate cancer. If you want it, just comment the word active below and my team will send it directly to you. Now let us get into your pants. This topic. What actually happens inside your body when you finish? Let me walk you through what is happening in your body every single time you reach the finish line, because I promise you it is way more complicated than feels good, done, sleep. Picture this. The moment you climax, your brain becomes a nightclub where every dealer showed up at the same time. We are talking about a full chemical assault on your nervous system. First up is dopamine, your reward chemical. It floods your brain at levels comparable to certain recreational drugs. This is why orgasms feel incredible and why some people cannot stop chasing them. Your brain literally thinks it just won the lottery. Next comes oxytocin, the bonding hormone. This is the same chemical that makes new mothers feel attached to their babies. In men, it creates feelings of connection, relaxation, and wanting to cuddle something, even if that something is just your pillow. Then the endorphins arrive. These are your body's natural painkillers, and they hit harder than morphine. That floaty, peaceful feeling after you finish? That is endorphins telling your pain receptors to take a vacation. Finally, the bouncer shows up, prolactin. This hormone is responsible for that immediate loss of interest in anything sexual. Scientists literally call this the post-nut clarity hormone. Yes, that is in actual academic papers now. Your brain goes from must reproduce to I wonder what is in the refrigerator in about 3 seconds. But here is the part nobody tells you. Prolactin does not just make you sleepy and philosophical. A 2023 study confirmed that it temporarily suppresses your testosterone production for 2 to 3 hours after ejaculation. Your body enters recovery mode whether you like it or not. Now let me hit you with something that blew my mind when I first learned it, and I went to medical school. Every single ejaculation costs you zinc. We are talking 3 to 5 milligrams per release, which is nearly half your daily requirement. Why does this matter? Zinc is the construction foreman for testosterone production. Keep depleting it without replacing it, and you are essentially running your engine without oil. Your ejaculate also contains fructose, vitamin C, selenium, over 200 different proteins, and a bunch of enzymes I cannot pronounce without sounding like I am casting a spell. Your body works hard to produce this stuff. It is not free. The average release is 3 to 5 milliliters. Over a lifetime, that adds up to roughly 14 gallons. You could fill a small aquarium. Please do not actually do that. I am just giving you perspective. Understanding this biology is step 1. Now let us talk about why doing this regularly might actually help you. The proven health benefits of ejaculating regularly. Time for the good news, and gentlemen, some of this is genuinely impressive. Let us start with the big one, prostate cancer protection. Harvard University conducted one of the largest studies ever on this topic. They followed over 31,000 men for 18 years. That is not a small sample size. That is a scientific commitment longer than most marriages and definitely longer than most gym memberships. What did they find? Men who ejaculated 21 times or more per month had a 33% lower risk of prostate cancer compared to men who barely hit 7 times monthly. 33% lower risk. That is massive. That is the difference between playing Russian roulette and removing half the bullets first. Why does this work? Think of your prostate like a storage warehouse. Stuff accumulates in there. Old cells, inflammatory markers, potential carcinogens, and general biological garbage. Ejaculation is the cleaning crew. Empty the warehouse regularly, and less nasty stuff gets a chance to cause problems. A 2024 European urology study confirmed this is dose-dependent. More regular clearing equals better protection, up to a certain point. Your prostate literally benefits from a consistent maintenance schedule. Benefit number 2, better cardiovascular health. Every time you become aroused and climax, your blood vessels get a workout. They dilate, they contract, they pump blood at increased rates. This is essentially cardio for your circulatory system. A 2024 Italian study found that men with regular ejaculatory frequency showed significantly better endothelial function. That is fancy doctor talk for your blood vessels work better. You know what depends entirely on blood vessel function? Erection quality. Treat your vessels well, and they treat you well. Beautiful relationship. Benefit number 3. Serious mental health improvements. The chemical cocktail released during orgasm creates what researchers call a neurochemical reset. Stress hormones drop. Feel-good chemicals spike. Your brain enters a measurably better state for hours afterward. A 2023 study in the Journal of Affective Disorders found that sexually active men reported 23% lower rates of depressive symptoms. 23% less depression from something that feels amazing and costs nothing. Show me a pharmaceutical company offering that deal. Benefit number 4. Dramatically better sleep. Remember prolactin? Combined with parasympathetic nervous system activation after orgasm, it creates perfect conditions for deep, restorative sleep. You fall asleep faster, stay asleep longer, and wake up more refreshed. This is peer-reviewed neuroscience, not bro science. There is a reason so many men pass out immediately after finishing. Your body is literally designed to sleep after climax. Benefit number 5. Immune system boost. Orgasm temporarily increases immunoglobulin A, one of your body's frontline defenders against viruses and bacteria. So technically, ejaculating might help you fight off colds. I am not saying it replaces washing your hands, but it is a nice bonus. Sounds amazing, right? Daily release equals superhero mode. Hold on, because if I stopped here, I would be lying to you, and I respect you too much for that. The real risks of ejaculating too often. All right, gentlemen, time for some brutal honesty, because I would be a terrible doctor if I only told you the fun parts. Risk number 1. Your brain can actually change structure. Dopamine receptor downregulation sounds complicated, so let me make it stupid simple. Remember your first cup of coffee? Felt like you could see through walls. Now you need 3 cups just to form complete sentences. That is downregulation. Your brain adapts to stimulation and demands more to feel the same effect. A 2024 Cambridge University study used actual brain imaging on men who engaged in daily pornography-assisted masturbation. Within 12 weeks, measurable decreases in dopamine receptor density appeared in their reward centers. 12 weeks, not years. 12 weeks of overdoing it, and their brains physically changed. The consequences? Reduced motivation, decreased satisfaction from normal activities, difficulty becoming aroused with real human partners. Your brain gets rewired to respond only to high-intensity stimulation, and real life stops competing. This is not religious fear-mongering. This is neuroscience showing structural brain changes on a screen. Respect it. Risk number 2. You might be killing your testosterone at the wrong times. Research from Zhejiang University in China discovered that testosterone levels peak approximately 7 days after the last ejaculation. Not immediately, not 3 days later. 7 days. The spike was nearly 146% above baseline. That is almost 2.5 times your normal level. If you are trying to maximize gym performance, energy levels, confidence, or just general presence, strategic abstinence periods might give you an edge that daily release cannot provide. Some men deliberately time abstinence around important events. Job interviews, competitions, big dates. Is it bro science? Maybe. Is it now backed by actual data? Also yes. Risk number 3. Your sperm quality tanks. For men trying to make babies, please listen carefully. Daily ejaculation destroys your sperm count. Your body cannot manufacture enough quality swimmers in 24 hours. The assembly line needs time. Optimal window for maximum sperm quality is 2 to 5 days of abstinence. Not 2 weeks, because then motility drops. Not daily, because then concentration crashes. 2 to 5 days. Tell your partner. Blame me. Risk number 4. A condition most men have never heard of. Post-orgasmic illness syndrome affects roughly 1 in 500 men. After ejaculation, they experience flu-like symptoms, brain fog, and extreme fatigue lasting up to a week. If every time you finish you feel like you are coming down with the plague, that is not normal. See a urologist immediately. Treatment exists. You do not have to suffer in confused silence. Risk number 5, compulsive behavior patterns. There is a huge difference between choosing to do something because you enjoy it and feeling controlled by an urge you cannot resist. If ejaculation has become your only stress relief, your only emotional coping mechanism, or something that interferes with work, relationships, or goals, then we have moved from healthy habit into problem territory. Ask yourself honestly, am I controlling this, or is it controlling me? If the answer makes you uncomfortable, that discomfort is valuable information. Now that you know both sides, let us figure out what actually works for your specific situation. The exact frequency you should be aiming for. Here is where I give you actual numbers instead of vague advice. The truth nobody wants to admit. Optimal frequency depends on your age, your goals, and how your individual body responds. Anyone claiming there is one magic number for everyone is either lying or selling something. Probably both. That said, here are evidence-based starting points. Men in their 20s and 30s who are not trying to conceive. Aim for 3 to 5 times per week. This hits the sweet spot. You get prostate protection, mood benefits, sleep improvements, and cardiovascular exercise without depleting zinc stores or frying dopamine receptors. Men in their 40s and 50s, 2 to 4 times per week. Your testosterone is naturally declining about 1 to 2% per year. Your recovery capacity is not what it used to be. Work with your biology, not against it. Men over 60, 1 to 3 times weekly. Still beneficial. Still protective for your prostate. Just more aligned with what your body can comfortably handle and recover from. Now here is the critical part most people skip. These are starting points, not commandments. Your body is unique. What works for your friend might drain you. What works for you might be totally wrong for someone else. The 2023 Harvard follow-up data showed something fascinating. The protective benefit against prostate cancer adjusted by age. Men in their 40s saw maximum benefit at 13 or more times monthly. Men in their 50s saw optimal results at around 10 times monthly. Men over 60 showed significant protection at just 4 to 8 times monthly. Translation: as you age, you need less frequency to get the same benefits. Your body is not failing you. It is simply changing what it needs. Here is another factor nobody discusses: the testosterone cycling benefit. If you want maximum testosterone for a specific event or period, abstaining for 5 to 7 days before that event creates a measurable spike. Some athletes and executives use this strategically. The science supports it. But if you abstain longer than 2 weeks, testosterone levels actually start declining again. There is a window, and now you know where it is. For fertility purposes, I will say it again. 2 to 5 days between ejaculations gives optimal sperm concentration and motility. Trying to conceive? Stop the daily sessions. Your future children will thank you. Finally, quality matters more than quantity. A rushed, distracted session provides none of the mindfulness benefits and all of the potential downsides. Intentional, present experiences activate your parasympathetic nervous system properly and produce the full chemical cascade your body designed. Take your time. Make it count.